changed this community as far as healthcare is concerned. We hear of healthcare reform in Washington, but I'm here to tell you, healthcare reform is taking place here in Montgomery. And our guests, our special guests, will let you know their role in making this happen. Not only is this happening at Jackson Hospital, but at Baptist Hospital, you'll hear from the president there that we're working with them to just change the way we do things for the betterment of the residents as they seek health care services in this community and the surrounding areas. I want to thank our board of directors for their patience over the last 12 years. I know, I told you it was coming, but you didn't believe me. And our staff, our medical team. I see several of the medical team who work at the Lister Hill Center. And we know that's not a great facility, and its time is done. We just want to thank you for your patience. I want to thank folk like the folk at Guardian, our consultants, many years back in 2000 for working with us to try to get on our own, try to do a facility. Brown Chambliss coming to our aid when nobody else was there. And I want to thank you guys personally and many others. However, it hasn't been until recent years, back in 2007, I believe, when the hospitals kind of got together and with the city and the county, things took a different turn. And I want you to hear from those folk who actually made the difference today. And I thank you for being here. And I'm going to turn it over to our first speaker, Mr. Ridling, who is chairperson of the board of directors of Jackson Hospital. Mr. Ridling, thank you.
Thank you. On behalf of the board of directors of Jackson, the employees of Jackson Hospital, led by Don Henderson, our CEO, I want to welcome you to our campus. And I want to congratulate everyone here on the cooperation that's made this possible. I'm glad we don't have a mic because I can whisper off the mic. This is a big deal. The cooperation between the city, the county, the hospitals, HSI, and Vision 2020 has truly been remarkable. It's been my pleasure and Jackson's pleasure to be a part of that. I want to thank you for being here this morning. And know that everybody under this tent and outside this tent is a part of what HSI and the community is doing. Thank you very much.
I'd like to call on Don Henderson, the President and Chief Executive Officer of Jackson Hospital, to talk about his role. Thank you.
Good morning. Good morning. Well, far be it for me to get in the middle of all these wonderful speakers behind me, but I did want to welcome you again to our campus here at Jackson Hospital. I think if you look behind you, I'm so proud of what we've been able to do here at Jackson Hospital. And I've been here for 5 years as the president and CEO, but we had some really good bones to start with. We started with some great leaders that were here before me. Jackson Hospital is 65 years old, and it is a wonderful facility. We started with a great new hospital. Now, over the last couple of years, our campus has been growing. We'd like to congratulate the board of directors of HSI and Burnell Mapp. But I've got to tell you that it was Jim Ridling and the chairman, as the chairman of our board, the then Mayor, probably right now Congressman Bright, Commissioner Dean, and Mayor Strange. What a great team we have leading and representing Montgomery, Alabama. And if it were not for their vision and foresight, and I've also got to mention our medical staff. Our medical staff is wonderful here. This whole thing was kind of a leap of faith. Now it's coming to reality, and I thank everyone for being here today. You're too many to mention, but thank you so much for coming out on behalf of HSI and Jackson Hospital.
While we're doing this here at Jackson Hospital today, I would have you know that we have been fully embraced in this project also by Baptist Health Systems. And it's amazing to see the changes in how we've been doing business in this city. And I look forward to just hearing Russ Tyner's, just your comments about how we are working together also along with Baptist. Thank you, Russ, for being here.
Thank you. Good morning. We heard an awful lot today about collaboration, and that's appropriate because this event and this particular building would not be possible without collaboration across private, public providers across this community, and unprecedented and likely unforeseeable just 2 years ago. A lot of that's driven by a reformed environment, but most of it is driven by recognition across our community that there's an opportunity to improve the wellness and the well-being of our community, and it's the opportunity and the responsibility of many and not just the task of few. It's a lot of collaboration that not only is about brick and mortar and about locations and about partnerships with HSI and others, but it's also about winning the hearts and minds of our community and our providers and creating that physician component that also will allow us to create more capacity for primary care and impact the wellness of our community. And that's what HSI and Baptist are working on currently, is creating opportunities around our training programs to train physicians and professionals in Montgomery, both family practice and internal medicine physicians. There's a lot of opportunity out there for collaboration that can really make a huge difference in this community. And it's not just about today, it's about a wonderful future and about a great group of people who have an idea about what Montgomery actually can be. So I'm exceedingly proud to represent our organization here today. I'm more proud to be a part of Montgomery, Alabama, and a productive provider in the river region. Thank you very much.
I've asked Chairperson of our board, Gilbert Darrington, to make some acknowledgments on behalf of our board of directors. Oh, thank you.
Hello.
Well,
Okay. Good morning.
Good morning.
First of all, I have to tell you that I've been on the board now for about, hey, can you hear me? Take it off. Okay. All right, can you hear it a little bit better? No? Okay. Well, like I was saying, I've been a member of the board of directors at HSI for a little over a year, about a year and a half. And when I was voted in as the chair for this year, I said either to set me up, throw him in the fire, or I've shown a lot of potential. And as I sit and see the distinguished members that are speaking today, I think I was thrown in the fire. So, but on behalf of the board of directors of HSI, this is truly a awesome occasion for us to be here seated to see that this project come to fruition today. It's truly a wonderful experience from a board perspective to know that we've been providing, as an organization, been providing care to our patient population in facilities that are not up to par, they're substandard and with limited resources. And this project allows us, it affords us an opportunity to provide care for our patients in a state-of-the-art facility in a place that will be acceptable and presentable, and we will hopefully increase the quality and the level of care that we give to our patients. And this project has, as all have said before me, that this project is not just an HSI project, it's not just a city project. This has been a collaborative effort between members of the entire region, and we just want to thank all of you. Again, to Commissioner Bright, who started the wheels are turning with this idea and the collaborative effort. Well, we thank you. To Mayor Strange, we thank you for your tireless efforts and working with HSI and donating the $1.5 million that helped this project. So we really want to thank you on that. To Envision 2020, Judge Gordon and Lynn Brashear, who's been there and throughout the course of this project to see us through and just offer guidance and support. We want to thank you for all that you've done for us. Commissioner Dean, for just your guidance and your leadership and just taking this project on. We thank you for all that you've done for us. And the meeting. And the meeting. Thank you for all your support. And just everybody who's had a hand in this. Again, we just want to send a sincere thanks, and also to Mr. Jim Ritlin and the board of directors at Jackson Hospital for donating the property that the facility will occupy. Without that donation, this day probably wouldn't be possible. So we definitely thank you for that. And anyone who I didn't mention who had a hand in this project, we just thank you so much for your support and your guidance, and we just ask that you continue to support us. Now, as this project continues to break ground and the doors open, we want for HSI to be an organization that can serve as a role model for other like clinics to emulate as we move forward. We look forward to providing a facility or providing a facility for our patient population that will foster positive patient outcomes and positive relations between the patients, the physicians, and their families. And because of the collaborative effort on everyone who's had a hand in this project, that will be a reality for us. So thank you so much. And again, I just want to thank you for coming out, sharing this day with us. Thank you for all of the staff and members of HSI, and continue to offer your support and your efforts to HSI. Thanks again.